Substance abuse addiction. It is a terrible, horrific plight. We wander through this life, and we're confronted with all kinds of calamities, tragedies that we can't avoid, people dying, people losing jobs and homes, terrible earthquakes and floods and hurricanes which devastate communities, viruses that cause everyone to lose their minds. Here we are beset in this world by countless things that can afflict us, and substance abuse has always been and will continue to be for a long time one of the primary scourges. Never has this scourge been more prominent than now. In the last 20 years, substance abuse related deaths have risen by a factor of 8, which is another way of saying they've been multiplied by 8. Another way of looking at that would be to say that 227% increase in the number of overdose deaths just from one particular substance. That's not even bringing into the conversation all of the other ones. The number of deaths from substance abuse, the number of reported cases of substance abuse disorders, and the frequency of those disorders has increased exponentially just in the past 10 years alone since I've been doing this. Part of the problem is a lack of understanding, a lack of knowledge about the true root of what substance abuse is. Understanding the true root can help us identify true and proven ways of changing the behaviors and thus the symptoms of this disorder and ultimately curing it. Because something done for long enough time with repetition can be learned subconsciously by the brain. We walk an uncertain path. Life is a mystery. We know a lot about the way that human beings behave. We know a lot about the ways that the substances of the world and the universe behave. But we don't know what any of it is, and we don't know what happens when we leave. And in this life, it's important that we learn as much as we can so that we can enjoy life, and prosper in life, and ultimately overcome obstacles which may seem impossible. I have learned through experience, my friends, nothing is impossible. Any obstacle can be faced, can be overcome, and can be learned and grown from, which is the best part. Passing it on is the greatest gift. Allow me to pass it on to you, friends. Thank you for watching. Hi, everybody. My name is Scott Conroy. I'm a clinical CASAC, certified alcoholism substance abuse counselor. I've been working in the field of clinical studies, clinical research, and substance abuse treatment for over 10 years now. I've also, for the last several, I'd say 7 years, been heavily involved in research having to do specifically with addiction as it relates to the brain and chemical impulses and biochemical behavior patterns that are changed in the brain. So it's a very complex subject. But I'd like to become informed about the area of study that I've done and also the field that I've worked in. So I've tried to keep up with the latest research and things like that on how certain substances affect the brain, on how certain preventative measures have introduced different options for treatment. Treatment has changed quite a bit, even just in the last 10 years, not to mention the last 50 to 100. So we want to keep on the cusp. So let's jump right into this. What is addiction and what is it not? Well, first of all, addiction is not a choice. Let me repeat that. Addiction is not a choice. It's not a moral failing, a matter of willpower, or a sign of weakness. Addiction is not a condition to be ashamed of. It is not a situation which is going to solve itself, nor is it something which should be faced alone. Those last two are very important here. A situation which will solve itself, it is not. Something which should be faced alone, also something that it is not. There are myriads of services out there available for people suffering from substance use disorders. Private therapists, counselors, drug treatment programs, inpatients, outpatients, and the field of study has come quite a long way just in the last 20 years alone with regard to this. One of the most important fallacies we need to dispel here: what addiction is not. It is not a choice or a moral failing. Addiction is a brain disease. Now, I've heard a lot of people argue with me about this one over the years. Addiction is a brain disease because, and both of these two we can quantify, using drugs over time changes brain structure and function. We know this for a fact. Some brain changes may persist after use stops. Also, we know this as a fact. Long-lasting brain changes affect cognitive and emotional functioning. Both of these can clearly be measured and perceived in long-term substance users of all varieties. So another thing that I hear a lot is that different substances affect the brain differently, which is true, but that some don't produce these long-lasting effects, which we know that they do, and we can quantify that. So again, long-lasting brain changes affect cognitive functioning, emotional functioning. Over time, the structure and function of the brain is changed. Sometimes these changes persist until long after use has stopped. The idea of it being a disease, again, is very controversial, so I figured I'd take a moment here to just simply bring up the disease definition here. A disorder or structure or function in a human, animal, or plant, especially one that produces specific signs or symptoms or that affects a 2. A particular quality, habit, or disposition regarded as adversely affecting a person or group of people. Wow, that's a pretty general definition. So yes, the symptoms which we're about to go into regarding substance use and specifically how they affect the brain certainly and most undeniably fall within the general definition of the word disease: a disorder or structure or function in a human, animal, or plant, especially one that produces specific signs or symptoms that can be measured, which we can and do quite a bit. So addiction is a brain disease. It's a brain disease that affects. Addicted brain is different from the non-addicted brain. So it affects the brain. We can clearly see here a large difference from left to right, and I will produce some more information about how those are occurring there. But prolonged drug use causes pervasive changes in brain function. So the changes you see here from left to right, the reason why they're so vague is because we're going to go into more detail as we go. But essentially the differences that you're seeing here, they're produced when high levels of, I guess you could say, the harder drugs are used. And we'll talk about the differences in substances a little later. But essentially speaking, when you get really high, your brain looks the way the right brain looks. And the left brain would be a more normal functioning brain. The problem with that is when people use drugs over long periods of time or in large amounts, that right brain right there, that's like lighting a match and lighting the brain on fire. Addiction as a brain disease. It produces a neurotransmitter imbalance, which we're going to talk about here in a minute. The disease model, very simply put, the way that we look at this is that the agent of the disease is the drug. The vector, or the area that it affects, are the dealers. We could also probably put a couple of different things in there. And the host, of course, is the addict, and that's the important thing. So what's the agent of the disease? Well, the drug itself. And the host is the addict. The need to, quote, stamp out, quote, the disease by eliminating drugs. It's the idea behind the drug war. The war against drugs that pervaded the 80s and led to the current system we have in place now, which I have a lot of problems with. Drug antagonist medications. Wellbutrin, naltrexone, antabuse, we'll talk about those as well. Hopefully there'll be time for that. Although I do plan on doing other videos, we can go into some more detail about those. But essentially, yes, those are available to you. A lot of options out there. So this is how it works. We're going to get into the nitty-gritty. Here's how people communicate. I speak to you, you hear me. So I am the transmitter and you are the receptor. It's a pretty simple way of understanding that concept. In the brain, it is essentially the same. Neurotransmitters, which you've probably heard a lot about, and receptors in the brain, probably you've also heard mentioned in your life. They look a little something like this little diagram on the right here. So these little axions, they're basically cells in the brain, and there are millions of them, and these little electrical impulses travel down them and across these gaps, which we call the synaptic gaps, the neurotransmitting gaps where the actual message is transmitted and the receptor receives it. There are millions of these in the brain. These little electrical impulses travel down and across and are received, and this is essentially what a thought is. Now, scientists have been able to hook people up with electrodes and look a little deeper into this, and it is estimated that upwards of 5 million thoughts per minute happen in the brain. And when I say thoughts, I'm not talking about your conscious, I like a bagel thought. I'm talking about subconscious thoughts, which happen in the background. They allow you to blink, they allow you to breathe, they allow you to think. And here we have a blown up version of this synaptic cleft and the synaptic gap. And again, you'll see these little dots in the middle of this little gap. And on either side, on one side you'll see a receptor, on the other side you'll see a transmitter, and the transmitter is again giving a signal to experience something. So there are different chemicals at play here, which we're going to go into a little bit. One of them, which you've heard quite a bit about, is called dopamine. Dopamine is also called the pleasure chemical. So among the many chemicals that are transmitted through these apparatuses in the brain, and again there are millions of them, is dopamine. And dopamine is essentially a chemical which relays a feeling of well-being or a killing of pain. It's a feeling of pleasure. And so here we have the dopamine, which is being released in the synaptic gap or the synaptic cleft. And as you can see, it's binding to the other side, which we like to call the dopamine receptor. Now, there are, again, multiple different types of these types of receptors in the brain, and dopamine is only just one of the chemicals that they receive, but specific receptors are more prone to receiving something like dopamine. And so here we have them specifically sticking to a dopamine receptor in the brain. And what happens is these clefts in these receptors, they get full. And that kind of lighting of that match where we see the brain light up from one side to the other, when instead of being light green and yellow, all of a sudden it turns bright yellow and orange and red. That's this process happening all over the brain, specifically in the pleasure center, which is located in the frontal cortex. And so you have this happening hundreds of thousands of different times, and that's where that feeling, that rush of getting high comes from. The problem, again, we see the same thing reflected here a little differently, is that the dopamine which binds to these dopamine receptors, they fill up, the receptors do. And what comes to happen is that multiple things happen. The first, and this is probably the most important, is that the receptor comes to expect that large or not naturally produced amount of dopamine. The brain is naturally producing a small amount. You're giving it a whole huge large amount when you get high or when you use a substance. So you're doing that over and over and over and over. Eventually it comes to expect that higher amount. And that's where we see something like withdrawal. All this stuff changes the substance and the fabric of these axons and the fabric of the cortex. So in conclusions, drugs change brain chemistry. Long-term drug abuse and addiction can lead to changes in the brain's anatomy and its chemistry. And these loss of neurons in the hippocampus that result in memory loss, the decrease in glucose metabolism results in a reduction of the brain's processing abilities. All of these adverse effects, they can be permanent or they can last a long time. I've seen patients stop using substances and deal with some of these adverse effects upwards of 2 years. These changes in the brain cause drug addicts to lose the ability to control their drug use. So here we have this cycle, if you will, starting, and it further deepens the addiction. It makes it that much harder for the addict to stop using at that point, because now it's come to expect that certain amount in that certain receptor, and it wants that certain amount. Again, remember, we're looking at a disease, a disorder or structure or function in a human, animal, or plant, especially one that produces specific signs or symptoms. Unfortunately for us, society's decided to deal with it for a very long time now, basically like this. Oh, they're using cocaine, they're using heroin, they're drinking too much, or they're drinking in public. Oh, they broke our laws, let's lock them up. Behavioral therapy, if you will, or behavioral modification, society's answer to social problems. Again, addiction is not a social problem. If we view addiction as being not a social problem, but as being a disease, the solution to that disease, obviously, quite frankly, and anybody that works in addiction knows this very well, the answer to that, the solution to that, the way to rehabilitate that is not and never will be something like a jail. And so we've very recently seen courts and states making moves to do more compassionate treatment-based alternative solutions for things like drug crimes. But it's only really just begun. And how they, view it as a moral or a social issue when this is essentially what, a few given substances do to the brain in any given moment. This is a snap photo shot, if you will, a visually represented photo shot of these parts of the brain that I keep talking about being lit up and what they look like. And also, too, keep in mind when you light these areas up over time, you do essentially produce brain damage. And so if you look at alcohol there on the bottom right, you see the little holes. Same thing with the heroin on the bottom left. That's a little bit more jumbled. It looks like the moon surface or a pizza pie. That can become permanent. And you stop using heroin or alcohol after 10 or 15 years, that damage doesn't just go away. It stays imprinted on you. And more importantly, it stays imprinted on the fabric of the way that you think. Remember, this is all affecting the way that you think. The way that you think does not go back to the way it was before you put that drug or that alcohol in your body or brain. And just as a comparison here, we see a normal brain on the left, an obsessive-compulsive disorder brain, a bipolar disorder brain, and a depression brain. If I could fit it there, which I can't, I would show you the heroin user brain or the methamphetamine user brain, and you would see, again, something distinctly different from your normal brain. And yet, society, whereas things like depression and bipolar disorder, although believe me, they come with their own stigmas, they're treated a little differently, though. They're treated compassionately. They are treated with mental health therapy, usually, and not prison sentences. And yet, when we look at something like substance abuse, it is so little understood, and it is so maligned, and people are so excised and avoided when they fall into addiction, and it's just so sad. Although there is treatment out there, and there is a way to change. So which brings me to my next topic, treatment and recovery. Can addiction be treated successfully? Yes. I am, as I said already, a certified alcoholism substance abuse counselor. I've been treating addiction for the last 9 years, and I can tell you that it's very difficult to do. The likelihood of people recovering long-term is very low. Addiction is a treatable disease. Discoveries in the science of addiction, which I like to, again, keep up with, have led to advances in drug abuse treatment that help people stop abusing drugs and resume their productive life. Things like motivational interviewing, which I'm probably going to do a little segment or series on. Cognitive behavioral therapy, which is going to be my next topic. My next video will be all about CBT, how it can be applied ethically, effectively, and immediately in your life. You don't need a guy like me or somebody in a suit or a doctor with a clipboard to do it for you. Brain recovery with prolonged abstinence. So you see here the differences in the meth abuser or the person let's look at the drinker. 15-year-old male non-drinker on the left and 15-year-old male heavy drinker on the right. Absolutely devastated in terms of activity in these regions of the brain. Alcohol acts as a sedative. And also, for all intents and purposes, when someone gets extremely drunk, they starve their brain of oxygen. So what you're looking at here on the right is exactly that, a starved brain. And again, this all redounds back to damaging fundamentally the tissues that we're looking at here in the brain area. But more importantly, it goes back to damaging the ability for these areas of the brain to function properly. If I think, I don't have enough food, I need to go to the supermarket, that simple common sense thought process may become disrupted if I use substances for a long time. At the end of that, it may look like, I need food, I wonder what I'm going to do. That lack of follow through that we see so often in people in early recovery, so easily explained. Addiction is created when the brain's reward system is rewired. It's a great way of describing it. By constant use of a substance or engagement in an activity. You're rewiring the thoughts that come out of that area of the brain. Instead of going to work and making money, you're rewiring it to say, let's go do crime and get drugs. Because I'd rather do that than go to work and make money. But you're rewiring doing that. You do that. Substance abuse, people who suffer from substance abuse issues do that to themselves. Common substance addictions, which some people may not be familiar with, alcohol, cocaine, marijuana, some of the more familiar ones. We have methamphetamines, hallucinogens, and then on the other side here we have food, pornography, internet and video games. It's probably a very big and under-researched one. All of these systems, guys, fall into the same definition of explanation of how it affects the brain and thus the behavior. Because when you change thoughts, you change behavior. If I think a certain way, I act a certain way. Fundamentally speaking, addiction is a brain disease. It's not a social problem, it's not a moral problem, and it's not a good or evil thing. Addiction is a brain disease. This is not a moral failing. This is not about bad people who are choosing to continue to use drugs because they lack willpower. So yes, willpower does come into play with this, but again, if you're changing the way your brain is able to think, then your willpower with regard to what decisions you make will also change. I hear people tell me this all the time. Oh, I have strong willpower. I can not do something if I don't want to. Yes, I know. But what if you don't not want to? Because you've changed the way your brain thinks now, and now your brain is telling you it's okay to do this. Or you'll just find an excuse, which is very common in addiction. So again, you have all the willpower in the world, but you won't use it if you don't want to use it. We decided to keep this video a little shorter, so we're going to stop here. Thank you guys again so much for watching. Let's face it though, substance abuse is a scourge that we've been facing in this nation for a long time. It's gotten worse exponentially as the years have gone on. In the last 3 years, overdose deaths had almost quadrupled. And that number continues to rise as each year progresses. I hope you guys will join me in viewing this as the scourge, as the disease, as the treatable disease that it is, despite its horrific, disgusting, and often sad symptoms. As we trudge this road of life together, as this journey that we're on together, I invite you to further explore this critical and dangerous issue with me, this subject that is often misunderstood. If you would like more information, please reach out. My information is posted. We also do private therapy sessions. For more information on that, feel free to reach out. And again, thank you for watching.